Since 1945, more than 510 fatalities have resulted from brain injuries just in the sport of football. Over the years, changes to rules and equipment were responsible for a rapid decrease in the number of deaths related to brain injury. Interestingly enough, as the number of fatalities due to brain injury decreases, the incidence of non-fatal brain injuries continues to gradually climb. Recent emphasis on concussion awareness in athletics has sparked an increase in the education, prevention, recognition, and treatment of sport-related concussions. However, more attention in this area is still required to continue to improve concussion management. Although most commonly seen in football, concussions can happen to any athlete in any sport. Baseline tests are a crucial tool in the return of an athlete back to competition. Today's market offers many different products for concussion baseline testing. Computer software such as Impact, Axon, and Cogstate measure cognitive function through a variety of questions based on concepts such as reaction time and memory. These programs provide a summary report for each athlete. This allows test administrators to monitor changes in performance after each test. The reports can be extremely useful as one of the many tools that help to guide the decision of healthcare professionals on return to play after a concussion. Because emergency personnel such as athletic trainers, EMTs, or team physicians are not always on site to witness a concussion happen, it is important to educate on the evaluation that occurs off of the field. Many times, athletes will walk into an athletic training room the next day saying they have a terrible headache and just don't feel right. This video will run through the proper use of the Sport Concussion Assessment Tool 2, or SCAT-2, which is used as a standardized method to evaluate athletes with a possible concussion. The SCAT-2 begins with a graded symptoms checklist. Athletes are asked to rate each of their symptoms from 0 to 6. Some of the 22 symptoms included on the SCAT-2 are headache, nausea, balance problems, sensitivity to light or noise, difficulty remembering, fatigue, and irritability, just to name a few. The Glasgow Coma Scale is also included on the SCAT-2 as a measure of the athlete's level of consciousness. It allows the administrator to record the levels of eye, verbal, and motor response in the athlete to monitor for deterioration later on. The next section of the SCAT-2 focuses on a cognitive evaluation. Athletes are asked orientation, immediate memory, and concentration questions and are given 1 point for each correct answer. Balance is also assessed by using a modified version of the balance error scoring system, also known as BESS. The athlete is asked to maintain their balance in 3 different positions while keeping their eyes closed and hands on their iliac crests. The positions are standing with both feet together, standing on their non-dominant leg only, and standing tandem with their non-dominant leg in the back. The athlete's non-dominant leg is the opposite leg than the one they would normally use to kick a ball. Each trial is 20 seconds long, and the test administrator will tally the athlete's errors. Errors include hands coming off the iliac crests, opening their eyes, stepping, stumbling, or falling, moving the hip into abduction farther than 30 degrees, or lifting the forefoot or heel. The maximum number of errors for each position is 10. If the athlete performs multiple errors at the same time, only 1 tally is given. Coordination is tested by asking the athlete to reach out in front of them and touch the test administrator's hands and then touch their nose 5 consecutive times. The athlete receives 1 point if they are able to complete 5 correct repetitions in less than 4 seconds. Athletes fail the test if they do not fully touch their nose, do not fully extend their elbow, or do not perform 5 repetitions. Lastly, the athlete is asked to recall the 5 words they were asked to remember earlier in the evaluation. This tests their delayed memory. They are given 1 point for each word identified correctly. The total scores for all sections are added up out of a possible 100 points. Currently, there is no normative data to create an acceptable cutoff score, but this value can be used to monitor improvements or declines throughout the athlete's recovery period. The SCAT-2 should not be the only tool used to clear an athlete. Athletic trainers and providing physicians should work together to combine all necessary testing in order to make the return-to-play decision for each athlete. Once cleared by a physician, an athlete is allowed to return to play. The return to play should be an individualized, gradual progression back into competition. A common way to break up this progression is into 5 phases. The clips shown here are used for a basketball player, but the exercises may be changed to be specific for any sport. The first phase should be a light aerobic exercise. A 10 to 15 minute stationary bike ride at a low resistance level tends to work well. The second phase should be slightly increased aerobic activity and the addition of light resistance activity. Increasing the speed and resistance on the bike and adding in bodyweight squats, lunges, and push-ups and sit-ups are just a few easy examples. In the third phase, challenge the athlete by increasing the workload a little more. An easy way to do this is to have them run some simple conditioning drills. They can also try some agilities such as ladders and defensive slides. For the fourth phase, you should incorporate sport-specific skills. In the sport of basketball, this can be done by having the athlete perform drills such as layups, dribbling drills, and shooting drills. The final phase would be allowing the athlete to participate in a full practice without restrictions. If all phases are completed symptom-free, the athlete should be allowed to return to competition. It is important to remember that each phase should be separated by 24 hours. If at any time the athlete's symptoms come back, they must stop and wait for them to subside. Once the symptoms have gone away, the athlete may begin at the last stage in which they did not experience any symptoms. Let's recap a few reminders about concussions. Never let an athlete who shows signs or symptoms of a concussion return to play the same day as the injury. Baseline tests are extremely helpful for healthcare professionals when considering return to play. Once cleared by a physician, the athlete must complete a gradual progression to return to competition.
Wait a minute at the time and place. Wait a minute, in my head in the game. Wait a minute, in my head in the game. Wait a minute, I gotta get my head in the game. You gotta get your head in the game. I gotta get my head in the game. You gotta get your head in the game. Come on, get my head in the game. You gotta get your head in the game. I gotta get my head in the game.